everyone, welcome to The Waiting Room. I'm Dr. Lauren Evans, your host, and today we are welcomed by Dr. Roisin Forkin. Dr. Roisin is a dedicated general practitioner with over 10 years of experience, and she has a passion for lifestyle medicine and holistic well-being, and she's committed to empowering her patients to take control of their health. Her goal is to inspire individuals to achieve their best health through personalised, patient-centred care that balances physical, mental and emotional well-being. As I said, she's got over 10 years of experience in private practice and urgent care, and Dr. Roisin has worked in both the NHS and the private sector and has more recently moved across into telemedicine with Online Doctor as well. Today we want to hear her story, which I'm really excited to hear, and including why she decided to get into medicine, her experience with working both in the NHS and the private sector, as well as we're going to get some simple, actionable advice to improve our well-being. So whether you're in healthcare and you want to hear the story of a sideline, or you're a patient looking for simple advice, then there's going to be something in this episode for you. So welcome, Dr. Roisin. A lovely warm welcome to the podcast.
Hi.
Hi. Firstly, what got you into medicine?
I got into medicine, I would say, largely because of my dad.
Okay.
So my dad is now retired, had a neck surgeon. And I can remember, for as long as I can remember, and as young as I can remember, I used to be really fascinated by his work. I mean, I'm talking 5, 6 years old. I used to sneak into his office and pull down his textbooks off his bookcase and look at the photographs, gory photographs of surgery and kind of ask him to explain, what is this, what's going on here, what surgeries do you do? He used to, I remember at the weekends, if he'd be on call and he'd be called into the hospital at the weekend, I would just beg him to go, can I come with you? Yeah, and he would I can't believe it actually when I think back. He would take me in with him. So I'd go into the hospital with him.
Into the surgery as well?
Well, I once got to see him perform surgery, and it was incredible, and I loved it. It was so good to see him in action. When I was little, I wasn't allowed into the surgery. He'd take me to the paediatrics ward and drop me off, and
free childcare.
I know, and the nurses would look after me, and I absolutely loved it.
Wow.
So from a really young age, I always was going to do medicine.
Yeah.
I didn't even consider anything else because it was just...
You're so lucky to get that experience. I know I certainly didn't have anything, and sometimes I get asked, why did you get into medicine? And I honestly can't remember why. It was just, I didn't have anyone in my life to give that inspiration, and probably didn't really know much about the career except for the lore around it, and obviously the respect that it comes. And obviously I was at a school where if you get good grades and you become a doctor, you become a lawyer, and so I just kind of went, and then everyone goes, you're going to be a doctor, well done, and you kind of go with that flow, and it just kind of happened over the years. So I couldn't pinpoint one point where I went, right, I'm inspired or I'm this. It was just someone else told me, well, this is what you'll end up doing. So it's amazing that you had someone who's already experienced and can give you that advice into how to get into a career like this, and the experience and the exposure. And you were still like, right,
I want to do this.
Yeah,
and I knew from a young age it meant, I can remember my dad leaving on Christmas Day, having to go and do surgery. I can remember birthday parties being cancelled or whatever because my dad had to go in surgery. I knew what it entailed from a young age, and I know I was really lucky to be so inspired by him and have that drive, because I think, like you, actually, a lot of people, it was... it's an answer I think doctors are encouraged to rehearse. Why did you go into medicine? And I think the reality for a lot of people is, you've done really well in school, and school sort of gently guide you towards medicine or law or veterinary surgery or dentistry or something like that. But I was very lucky to have someone that inspired me from such a young age.
I think that's really good, because I think a lot of medics can sometimes be, because of the guiding, end up on what I call a treadmill to a destination. They don't really know what the outcome is. And you already knew the outcome, and you're inspired, and you're like, right, let's go for it. Yeah. So you started first medical school, you're out in Aberdeen, is that right?
That's right.
Obviously you didn't go down the surgical route. What route did you go down?
I did toy with doing surgery. I remember my dad towards the end was like, you should do surgery. I think you'd be a great surgeon. And I sort of toyed with it, but I ended up studying general practice. And I think that's because I remember when I was doing my junior doctor training in the hospital, and you'll recall yourself because you've done this, you rotate every 4 to 6 months to surgical specialties, I know, or pediatrics. You saw a whole range of things, and every job I was on, I was like, I'm going to do this. I love it. No, I love this. This time it's definitely this one. I could not choose. I loved all of them.
Yeah.
And then I remember the night before we had to do our applications, I was really torn. I was thinking about.
I was the night before as well.
Were you really? Were you?
Yeah.
I was thinking anesthetics, or because it's a kind of a mixed surgical medical. You know, you've got ITU, but you've got surgical patients, or general practice.
Yeah.
Because my rationale was, okay, I can't pick a specialty. If I do GP, I will get to see almost everything.
Yeah, but also you're less likely needing to move and things like that, because it's more likely you can get a specialty in the area that you're already living in or into the training program.
Absolutely.
Yeah.
And there was that as well.
Yeah.
But yeah, that's how I got to
I was last minute. I was everything in the lead up to that point, you know, junior doctor years, we have to choose your specialty.
Yeah.
It was going to be obstetrics and gynecology.
Was
Absolutely
it?
love it. Even in medical school, right through, everything was blocks of extra things for my CV to get into that. And then the night before I went, no, I want to not have to potentially move, and I want to have what I thought would be more easy 9 to 5 and everything else.
Completely. There was absolutely that for me as well. Actually, I remember thinking also I will
It's
be
not
able to,
easy,
it's
is
not,
it? But we'll talk about that in a
yeah.
second. So what, you know, early in your career, getting into general medicine, obviously you moved on to several other things, but what's something that stands out early in your career that kind of shapes the doctor that you are now?
It's a difficult one, because I think when I think about that, there are so many. An incident that comes to mind, it seems really banal and kind of boring, but it honestly stands out for me so much. It was, I decided to do GP, and I had this mentor who really inspired me. And when you're in your training, you might remember there's a bit of time when you're on a bit of a leash, quite understandably, for safety. They kind of get you to see patients. And then if there's anyone that you're struggling with or they're complicated, you go back and you discuss them with your supervisor at the end of the day or in the middle of the clinic. And I remember I was looking after this man, and he was, say, mid-40s, fitting well, came into me with this rash. And it was a, I think it was a dermatitis, an eczema.
Yeah.
He was fine. I saw the rash. I said, look, this is a dermatitis. Here's your creams. You'll be fine. Off you go. Gave him some advice. And then he came back again a couple of weeks later, and objectively the rash was better. Still there, but he was, you know, I'm a bit worried about the redness, and it's a bit scaly, it's a bit itchy. And I thought, okay, we can try another cream. We can. And then he came back again he came back again a couple of weeks later. And I felt like we were making progress, and I was getting the impression he did not. So I remember after the 4th visit or so, I remember saying to my supervisor, look, can I talk to you about this patient? I'm not worried about him. I think he's getting better, but he keeps coming in, and he's got this rash, and it's not completely gone, but it's a dermatitis. It's going. And he said to me, okay, what does he think it is? And I remember thinking, well, it doesn't matter. I've told him it's a dermatitis. I didn't quite say it like that, but he was like, you need to find out what he thinks going on.
There's something he's worried about, something that's why he's coming back.
He's worried about that you have not pulled out of him. He said patients come in, and I always remember this. He said patients come into you with a balloon. They're holding a balloon. It's your job to take that balloon off them. And now you have that balloon, and they get to leave.
You're the one that has to worry about.
Exactly. They get to leave the practice without the balloon. And I remember thinking, okay, next time he came in, I just said to him, what are you worried about? What do you think's going on here? And then he said to me, I think I've got cancer. I think this is a kidney cancer. And I remember thinking, wow, I don't know how you got there. I would never have thought to address that. And I remember going, it was like a light bulb moment. You know, I could explain to him, this isn't cancer, and this is why, and this is dermatitis. And I remember thinking, you've got to be curious. You've got to be curious with patients. They have lots of the answers. And it's about finding out what they're worried about. Because I think I've treated your dermatitis. I think I've treated your infection or whatever. If you don't get to the bottom of why they're here, you've not fully treated them.
There's more. The person is more than the rash in front of you.
Exactly.
They're at home worrying. They're probably losing sleep. They're probably not going to work. There's all these other aspects that you need to kind of address. And we always called it ICE. Ideas, concerns, expectations. What are you expecting from today's visit? What are you most concerned about that I can either address and look into, or actually reassure you it's not that that thing? Or, you know, ideas that actually sometimes patients are right as well, and it's important to address that, but also their ideas might be something that's creating concern that they don't need to be concerned about, and we can relieve them for it. I love that. And so it's I love the phrase that you just said there. It's important to be curious. Yeah.
Yeah.
And so you took that moving forward, that's sort of like you call it a banal case, but it's obviously had an impact to change your practice. And when you started being curious, did you find that changed how you work, like the satisfaction from your work, but also satisfaction of your patients?
100%.
Yeah.
It was such a pivotal moment because from then on I found, so then I always did ice.
Yeah.
Because they do bash on about ice in your training, and it can become a bit repetitive. And unless you practice it, and something I think like that happens, you don't realize the value of it. So then I never didn't do ice ever again in a consultation. And what I found is, if you give patients that opportunity to tell you what they're worrying about, what they think's going on, because these days people have Googled.
Yes.
It's rare to find a patient that has not Googled their symptoms before you come in. If you don't address that, the consultation is incomplete. And I think you also, it's really good for rapport. It's right, well, I trust you with your opinion, you trust me with mine.
Yeah.
You're kind of sharing, you're collaborating, and I have found it a really useful tool to just bring patients into the conversation about their own health.
Yeah. And it's not something patients will always bring forward themselves or be forthright with. And despite not being forthright with something, if they've still got that balloon in their hand, they leave feeling like, this is why people think, NHS, or just in general with your doctor, you're feeling rushed, you're feeling dismissed.
Not listened
but actually,
to,
this is because there's another language or there's another layer to that whole conversation
layer.
than just the rash that present with, and a very good treatment plan for that rash is a whole other layer. And it's so important to be a practitioner who explores what extra layer is. I love that.
Exactly.
How did you find working? Because originally you worked in the NHS, so you're GP in the NHS. How was your experience being a general practitioner in the NHS?
Well, I mean, I'm really grateful to the NHS because although training was hard, it was very formative. It taught me discipline, it taught me structure, it built my resilience. I think being a general practitioner, it was a very mixed bag, a bittersweet process in the NHS, I think, because it was great, building rapport with patients, learning how to consult with them. But there are so many pressures that NHS GPs are kind of working up against that what should be a very rewarding, incredible job, unfortunately, I think it could be quite weighed down by the kind of under the table hidden pressures that GPs are under. And I certainly felt that.
And it's like how you come across as someone who really wants to help the patients in front of you. You're, like you said, with ideas, concerns, expectations, wanting to get that balloon off the patient, wanting to help in all the other layers of what a good family general practitioner can do. And, like I always remember hearing the stories of, you can be a general practitioner, you'll see someone from baby to cot, from what was it? Cot to casket, that was the word.
That's right.
And you get to learn, be a big part of their lives as things. And I think nowadays it's really difficult. It's hard to do that. And I had that experience working in general practice. And, I'd said earlier in our conversation, it was the easy choice. It certainly isn't. I know that nowadays, I'm certainly not that old, but I'm already finding the mental load of lots of different conversations in one day and having to give your all, because you want to have every person who sits in front of you have your best version of you every 10 minutes plus the workload. I remember I was actually in at 7:30 and leaving at 7:30 and no real lunch break at all. I think that's perception is not always that's actually what's happening behind the doors.
I know that.
How did you find that?
I mean, my experience echoes yours perfectly.
Yeah.
I remember, as we discussed earlier, thinking GP would be a slightly better lifestyle choice as well.
Yeah.
But that's absolutely not the case. And exactly what you said, I want to bring the best version of myself to each patient. And again, that mentor I was telling you about earlier, I remember him saying to me, that patient has booked that appointment. They've been thinking about it all day. They've been thinking about it the night before. It's a big deal in their day. Yes, it's just 10 minutes slot of your day, but it is so important. They've taken time out of their day. They've been worrying about this thing. And it got to the point where I was, exhausted and stressed by, we're so well trained in the UK. But you do not have the opportunity or the resources and the time to use that in the appointments that we had with patients. So I really felt the burden of that towards the end of my GP training, thinking there has to be another way, because actually continuity of care was very challenging. The idea that you would get to know patients, it just doesn't really happen anymore. And it was just new patient after new patient. And sometimes you'd see the same person again. But the reality actually was, you have these 10-minute slots. You're quickly firing through pages and pages and pages of notes that are often disorganized, trying to get to know this individual before they come into the room to make the best use of the tiny amount of time you have with them. It's not safe, and it's not rewarding. It's not the best practice for the patient. It's very, very challenging for the doctors trying to implement that service, and
it's frustrating all around, isn't it? It's frustrating because we've had good training, so we've got the skills to hopefully be able to help people. Just our hands are tied, but also it's supposed to be frustrating for the patients.
Incredibly.
How did you find that? Because you moved obviously from NHS to private, and this is obviously when you were living in London, which is a lot more easy to make that transition across. What was the difference for we'll start with firstly for you as the general practitioner. What was the difference that you noticed moving across?
Well, the first job I did when I got to London was, I thought I'd go back into a bit of emergency urgent care, because I did love A&E, my A&E jobs, and so I started working for a private urgent care, and I remember it so vividly, starting in this job with this lovely office. Not that that really matters, but I had this working computer that was fast, and it took me 2 seconds to log onto it. And there was a staff room with a coffee machine, and there was a water machine if I wanted. Anyway, and then it was like night and day. It was like the medicine that I dreamed of being able to practice. If I needed, fair enough, this experience was in a hospital, but I was working as an urgent care physician or GP. If I needed an X-ray for that patient, they're not going to wait 6 weeks. I can get it for you today. I can get your bloods done today. I can do everything. I can refer you to a consultant. I can get you seen today, tomorrow. I then moved into private GP because I missed general practice, and it was exactly the same. I couldn't believe it. I had more time with my patients.
Did that increase your frustration for why it can't be? I know we understand why it can't be like that, but knowing it's possible and seeing it in action and actually being able, it must be so satisfying, but also must be frustrating that it's unfortunate. It just is. It's unfortunate that not everyone has access to that, but we're changing that, which we're going to talk about in a second.
Yeah, but it really, really ignited this passion in me to try and reach more people, because I think for me, I think the private sector, there's the convenience aspect to it, and people like to kind of have this now when I want it, but also the knock-on effect of being able to get tests, investigations and referrals, even in general practice for patients. It goes far beyond the convenience of it. It is life-changing. They're not sitting, waiting, worrying for 6 weeks about an X-ray. It might actually be totally fine.
You're taking the balloon.
You're taking the balloon from them, and you're just dealing with it in the here and the now. It's so much more efficient. It is because I saw patients in half an hour slots, which sounds unbelievable for general practice. It sounds like a dream. And there are times when it was just a sore throat. But we make good use of that time when that happened. We got into lifestyle, we got into sleep, we got into broader health aspects. But for the complicated stuff, I could just do the bloods right now. I can just do the ECG right now. I can be having somebody organise the X-ray while I speak to the consultant on the phone right now. Things that take months or longer in the NHS, we can sort out for you on that day or in a couple of days' time. I've got the worry. No, I've taken your balloon. You don't need to worry. It's all being done, and whether it just works so well.
But it helps you as well, because imagine things taking weeks, but you're juggling and you're holding all these plates while these things are taking weeks. Must be really satisfying to address everything that you want to get done and get the answers fairly quickly for that person. And also just relief for you. It's less on your shoulders.
You know what? You've totally hit the nail on the head, because the one thing that I found stressful one of the things I found stressful in NHS GP was, you'll know this yourself, but it's like you have a workload in GP, and it doesn't matter if you think you can clear it. You've come in at 7:30, you're going to try and get through your admin. It never clears. It never clears. So it's so stressful. You're always on the clock, and you're always trying to clear this pile of work, but it never clears because you're waiting for X-rays, tests, results, letters, whatever. But the difference to me in
you're holding everyone's balloons done, at
exactly. But the thing is, actually, in a day or in a couple of days, everything's done and dusted. In one way, and it was extremely good for me. Actually, I found it
must be so much better for your mental health, the patient's mental health.
It was.
And then obviously moving across to first, in your GP practice, you start introducing telemedicine, and now you're going to be working alongside Online Doctor, which is a mostly private medicine, private GP telemedicine service. What's the difference with telemedicine? Do you want to just explain, because you were explaining to me earlier, what is telemedicine for those who don't understand?
So telemedicine is basically when you consult with your doctor either on the telephone or via a video call where they can see you. And by and large, it should go like a normal in-person consultation. Obviously, they can't physically examine you, but you know, they can see you. You can send in pictures beforehand of skin lesions or rashes. It's just online doctor consulting, really. Yeah.
Yeah. And how have you found that being moving across? What are the benefits you found for both you and the patient having a telemedicine option?
I mean, I think it's brilliant. I really do. I think the pandemic blew open the doors for it. I think lots of surgeries did a bit of telephone consulting before, but it was more triage and the odd consultation. But certainly the pandemic has shown, I think doctors were a bit hesitant of video consulting, you know, en masse. I mean, you know, I don't think anybody wants it to fully replace the in-person consultation, and people were a bit hesitant about making it the norm, but actually the pandemic's just blown all that open, and we saw, well, we can do it, and it is safe.
And patients actually really like that option.
Exactly. I mean, you have to think about how unbelievably helpful it is to them. You know, if you think about a normal person who needs to go and see their doctor on a Tuesday afternoon, normally those people are in work. So this means they have to leave work. They've got to have that journey there. They've then got to wait in the waiting room. You don't know how long you're going to be waiting. Then there's a journey back. It's an enormous amount of time, actually, for that person and for their employer, which is relevant. Stress for the person, just trying to fit it all in at once. I think it just makes healthcare so much more accessible. It removes a barrier to booking the doctor's appointment, because it's very easy to go, I need to remember to book that doctor's appointment. You put it off. I've got to, you know, drop the kids off or pick this up, or I've got work, and it's easy to let it fall down the queue.
Because there's so many barriers previously, but if there's less barriers, people are actually going to look after their health more, because they're going to take action more easily. I love that.
Barriers.
I love that.
Looking after yourself.
But you even said earlier that, you know, you were in private GP practice that was actually resistant to having telemedicine at first during the pandemic, wanting to see everyone in face-to-face. But actually, when they did start, at least the doors blew open, when they did start to use it, it was actually so positive for both patient and the practice overall, in terms of just people really loved it. That even though we can see people face to face more now, there's still a huge portion that are choosing telemedicine instead of face to face because of that.
There are. And if you think, well, certainly in my experience, when I was working in this brilliant practice in London, we had lots of patients who would travel or be on holiday, and we could video consult with them in other countries because we could see them, and it wasn't such a strange thing to do. It was like, okay, fine, well, let's check the time difference. Right, great, we can just let me see you. And they got so much comfort from knowing that we will look after you wherever you are in the world. I love that. And it was just great for continuity of care, and I think it works really well.
So now, having worked both in the NHS as a GP and now working in telemedicine private primary care, how do you find the two systems compare, especially for patients? Like, what are the strengths and limitations of both?
Well, I think for patients, telemedicine in primary care, it just really helps to make healthcare accessible, removing barriers for people so that they can look after themselves better, and makes it easier to prioritise their health, because it fits much more easily into their day-to-day life if you can do a teleconsult with your doctor.
Absolutely. I mean, it just seems it's like a no-brainer if you can do it without all the barriers of trying to think of parking, where to go in your day of work. It just seems so much easier. What about some limitations?
I suppose the limitations would be if somebody is very sick and you're worried about them and you want to make sure they get the correct urgent or emergency care that day, there and then. So it's about correctly signposting them to potentially A&E or urgent care. And there's always that slight worry as a doctor, what's going to happen next with them, because
you don't know if they'll follow through sometimes.
You don't know if they'll follow through. And I think by and large patients do, though, that, you know, they respect our advice usually. And I think it's just that for me would be the main one. But most doctors teleconsult with that at the forefront of their mind. What is the safest option for this patient, and how do I make sure nothing bad happens to them? So making sure that they're then redirected on to the correct person if I'm not that person. Yeah,
I love that. For the patients who are considering booking appointment through telemedicine, what's it like for them? What process do they go through? Because they might not really understand what's involved in that whole process.
Yeah, absolutely. So it's quite straightforward, really. Yeah. They go onto the online doctor platform, and it's all booked online. So they can choose the doctor they want to see. They can see the doctor's availability on a calendar, because obviously the doctor has their own calendar and their availability is made available online. So the patient can pick a date and a time that works for them. They're then sent, once they confirm that, that slot. Obviously, the doctor is notified, but the patient is sent a very straightforward link that they just click on to open up the consultation at the time that the consultation is. Then once the consultation is done, so they have their video or their telephone consultation with the doctor. Once that's done, if there are any prescriptions or further admin that needs to be done after the appointment, that's done automatically, quickly, discreetly for the patient.
So easy.
So easy.
Love it. I guess we kind of covered this a little bit, but I wanted to ask you what excites you about telemedicine now that you've experienced it. And I guess I can add on to that. Where do you think it's going to go in the future?
You mean telemedicine as a whole? The whole concept
or private primary care, I guess, is where you've got the most experience.
Yeah, I mean, I think, well, certainly in London, private primary care is much more the norm than it is in a lot of places in the UK, and it's grown so much even in the 5 years, 6 years I was there, and urgent care actually as well. So I can't see it not continuing to grow exponentially. Patients are, there's no hiding from the fact that of course the NHS is struggling massively at the moment, and we want, I want to help with that. Private doctors want to help with that.
Support the load.
Exactly, support the load. Now, of course, I know, there is the difference in that you pay for these consultations, but it's helping support patients who are looking for other options, can afford to pay a bit for their healthcare and don't want to wait, can't wait. It's just I see it just continuing to grow.
There's a definite need there. I think there was originally some hesitations, like there was, in London during the, like you even said, there was some hesitations to exploring it, but now you've experienced it, you think it's fantastic. And I think the hesitations are going lower and lower, and more people are actively seeking out telemedicine to achieve their needs because they're not getting it. The reality is we're not getting them fully in the NHS anymore. But obviously it might not be appropriate for everyone, or it is appropriate for everyone because you can signpost people. But who are the best patients or perfect patients, who really should be looking into telemedicine as an option for them if they feel like they're needing to get some advice from a GP?
Well, I mean, as you just said a moment ago, anyone can engage with telemedicine, and usually that doctor, if it's not the right thing for that patient, will clearly signpost them onto where they should go. But most people will benefit from it, and I think you just have to think about busy professionals, working parents, stay-at-home parents, anybody who's got a busy life, who wants to make sure they look after themselves, but needs that bit of flexibility, needs that bit of space carved out for them where they don't have to take an afternoon off and leave work, or worry about picking up the kids from school or doing the drop off, or somebody, for people who just need the space to be able to look after themselves and not make it really stressful, even just booking and going to the appointment.
I know for me, something that actually stops me booking in even with my own GP is the fact that the way my practice works is you need to call at 8:30 and then you're in a queue, and that's exactly the time that I'm trying to get my kids off to school. So you're on that queue, and then suddenly you missed everything, and just because, and then it has to be booked on a day, because generally we get appointments on the same day that you book in. So you're thinking ahead, like, what day might I be flexible? And they might just give you any time and you might not know. So it's also that if you've got a busy life, not knowing, well, when am I going to get my appointment? So even just to have that little bit of control.
You have control.
To be able to say, right, well, I actually really want help now. I missed the 8:30 slot that I was meant to call, but I'm not feeling well now, or I need some advice. I need to get in touch with someone who can signpost me or help me or take some tests or whatever. Just at my convenience or at my diary.
Absolutely.
It just seems ideal.
It does, because I mean that process that you just described there of, there's lots of even jokes about it on the internet, trying to get through to your GP surgery at 8:01 or 8, that's a really stressful process. I have done it myself. It's incredibly stressful. Life is stressful enough.
Yes.
And I think it's perfectly reasonable to provide for patients to expect to be able to have some control, some autonomy over when they go to the doctor, when they book in, who they see. And that's been taken away from patients, actually. I think that we've lost quite a lot of that during the pandemic, and a bit before, but it's certainly, become more difficult. And I think patients want that. They deserve that.
I think people also just don't know it's the options there. So this is why it's important for us to talk about that. But I want to switch the topic a little bit, if you're happy with that, and talk a bit more about you, because you've got a great story. And I want to understand a little bit more about what areas of healthcare that excite you the most.
I am very excited about lifestyle medicine, preventative medicine, holistic medicine.
Yeah.
They are subjects that really excite me.
Yep.
I think I believe so much in the power that people have themselves to look after themselves.
Mm-hmm.
You know, most people will see a doctor once a year, if they see them at all, once or twice a year for a few minutes,
Yep.
you know. But the rest of the year, your health is in your own hands. And I just feel like there's so much scope to make yourself well by small consistent lifestyle tweaks. We have the power to do that for ourselves. I'm not sure if the knowledge is quite out there, you know, so I'm passionate about getting that out there and helping people help themselves.
And do you mean the medical knowledge or the patient knowledge?
I mean the patient knowledge. I mean the patient knowledge. I mean, it's so confusing. I mean, for patients, I mean, my goodness, you just open up Google or any social media platform and there's just a barrage of health influencers, health information. And whilst it's great, and I do think it's been really helpful to, you know, help people source information, you know, educate themselves. But there is a lot of misinformation out there, and it's frustrating, I think, as a doctor, but it's very confusing for patients.
Yeah, but I think it can be confusing for doctors too.
Yeah, absolutely.
Because years ago, about 10 years ago, started lifestyle medicine movement, different things. Like I'm a huge, passionate fan about lifestyle medicine as well, so we could talk about this for ages.
Awesome.
I'll be honest, at first, I thought it was all woo-woo. I thought if there's no clinical trial about it all, that it must be nothing. But then you start thinking, well, anyway, we're not going to go into that. But started through my own journey, having tiredness and different fatigue, just changing through lifestyle things. But then I started looking into it and being like, well, there's just so many different advice. And so kind of started connecting with other medical practitioners who are very passionate about lifestyle medicine. But one would be saying, no, vegan is the if we're talking about diet, vegan is the way to go. Another one was saying low carb, high fat. Another one's going high protein, you know, different things. And we ended up actually breaking apart. A few of them are part of the British Society of Lifestyle Medicine and all these different things. But the point is, we were all trying to help. We all wanted to realise there was an aspect of that we had control over in our day-to-day lives of to shift how we feel, how our bodies function, how well we can be in our life, essentially. But it was even confusing between us. So what directs you or what guides you with what advice that you give patients?
I stick to the foundations of sleep, exercise, nutrition, and stress management.
Okay.
I feel like it's very difficult for a person to be healthy and well if you haven't sorted out those basics. And they almost seem, you know, boring, I think, actually, but they're really not. I think there's kind of not enough focus on those. Even I can remember with my medical training, I don't really remember learning much about these things.
No, we didn't learn really any nutrition.
Nutrition was, yeah. So I kind of have gone on a whole new relearning journey about all that over the last few years. And it's just absolutely fascinating. And, you know, lots of it doesn't involve any drugs or any doctors.
Yes.
It's just things that people can and should be doing at home. Yeah. If you know, because there's so many people out there, and I you know, there's the whole supplements, which is great. There's a whole what diet you should be eating, whether you're vegan or carnivore, all that sort of stuff. And then you're on to medicines. But there are so many people out there who are, for instance, spending a fortune on supplements, a fortune on skincare, a fortune on you name it, but they sleep 6 hours a night or 5 hours a night, or they eat.
They're not getting those basics down.
Exactly. Yeah. So they eat lots and lots of processed food, or they don't exercise, or they're really stressed all the time. Yeah. And the problem is, if you don't have those 4 things sorted out, you're always chasing your tail. It's really hard, actually, for anybody to be truly well. Unless, I mean, you don't have to be perfect, but if you can just improve on all those things. Yeah.
So let's go through them.
Yeah.
Sleep. Tell me.
My favourite topic. I could.
It's my
talk
hobby.
You to sleep.
It's my
Is
hobby.
It really?
No. I wish I don't have time for that hobby, unfortunately.
You will make time after this podcast.
Tell me about sleep.
I mean, my goodness me, sleep. I mean, my passion for sleep started. It was years ago when I read Matthew Walker, Why We Sleep.
Sorry, say that again.
Matthew Walker,
Yeah.
While We Sleep.
While We Sleep.
Have you read that book?
No.
You must read that
Okay,
book.
I will
You must
add
read
it.
that book. It is just, it changed, it really, I think it was actually pivotal in starting me on a kind of an interest in lifestyle medicine. That and my mum, who is fanatical about health.
Got great parents for inspiration.
I know. She's actually incredible. But sleep is just one of those things, and you see it in London all the time. It's this sort of I sleep 4 hours a night badge of honor, and it drives me mad. And I definitely was that person.
Yeah.
You know, I can. You know what it's like when you're training. You get home at midnight or 1. You need to unwind for a little bit, and you're back in on the ward at 7
You do,
o'clock
even
in
as
the
not
morning.
even training as a GP. I think
No,
there's so much mental load
completely.
to take all that home with you. You need that time to switch off.
You revenge procrastinate,
Yes,
don't you,
yes.
at night, just to get that time back. And you're up watching TV, you're scrolling on your phone, or having a glass of wine. And actually, that time you would be so much better served.
So what's your advice for sleep? If it's just a quick one.
Quick one. Try to get 7 to 8.5 hours sleep a night.
Yep.
And the most important thing about sleep is if you can just make sure you get up and go to bed at the same time every day. That is even
Get in that cycle.
If you can just get into that routine, do that at whatever cost for a couple of weeks.
Yeah.
You're on the right track.
And what's the second one? Was it exercise?
Exercise, yeah, absolutely.
What's your advice for that?
Just move your body. You do not have to be a professional athlete. You do not have to be doing HIIT training every day of the week. You don't need to be in the gym for an hour a day and running 10K. Just move your body every day.
Yeah.
Walking is one of the best tools. Brisk walking.
Yeah.
If you're one of those people that you're already established, you're a runner, you're an athlete, you go to CrossFit, whatever, that's great.
Yeah.
But most people actually don't do that. So if you're looking just to start with exercise, and it can just be your continuing mode of exercise, brisk walking for 150 minutes a week. 20 minutes a day. That's all you need to do to get going with your health, to build up a level of health.
Take
and
the
maintain.
stairs.
Take the stairs. Don't take the
little
lift.
things, little shifts that you can do in day to day, which don't have the barriers like we talked about earlier. Just trying to remove the barriers of why people don't start. And do you think people with their smartwatches who can track their steps, is that a good marker, or are you a fan of
Big fan
of markers? Then
big fan.
Good.
I actually don't have my smartwatch on today, but I normally always have it on. But basically, I suppose if you look at the kind of research behind it, actually what's so fascinating about these smartwatches, whether you kind of intentionally go out and buy one or you're kind of get one for cheap with your mobile phone deal or you're gifted it, the moment somebody has personal metrics, whether they were interested in tracking their steps before or not, it's a major hook. And you give somebody personal metrics, they now know something about themselves. People who have smartwatches, they walk 40% more than people who don't. And you could say that's self-selecting, but I think there's been quite a lot of research into it.
True, because other people who walk more, the ones who buy the watches.
Exactly, I know that. But I even know for myself, I remember I was gifted a Fitbit like 10 years ago. And I remember thinking, okay, fine. Oh my goodness. It just started a love affair with steps. I couldn't believe it. And I thought, if I've not got my step target today, I would get out of bed and walk around just to make sure I had my step target. And I think they're really important to help people just get them interested,
I can vouch for that. I got given a hand-me-down iWatch, and it just has that step count. And you just, have I got that one?
You can't help
so
but be
close.
curious. And you just think, just do it. Well, fine, I'll do my step target. And I think as well, lots of them track your sleep now as well. I think that's another really good way of getting people engaged with their sleep. When it jumps up on the screen, your sleep score is poor and there's a sad face. I'm going, well, why? And that's exactly the same thing that happened to me.
We're all toddlers who want our star chart.
Exactly. It does work.
What about the next one then? Was it nutrition? Yeah. Tell me about what's in simple, because that one's a minefield.
That is just the biggest topic ever. But I think the best piece of advice would be everything in moderation. I know that's a bit samey. If you're looking for, crash diets don't work, fad diets don't work. If you're interested in the evidence-based, the Mediterranean diet, if you've got to pick one. But ultimately, I think it's everything in balance, and just try and be as whole food based as you possibly can, and avoid as much processed food as you can.
I think samey is for a reason.
Yeah.
It's because it works.
It works.
It works. So, and what was the last one?
Stress management.
Stress management, okay.
Again, it's such an important one because, imagine you're sleeping right, you're eating well, you're exercising, but you're stressed all the time.
Yeah.
Again, it's very difficult for you to feel being stressed is exhausting. Chronic stress is so bad for your immune system. And if you're stressed all the time, it will take away enjoyment in life. And actually, you know, it's a really challenging one to get on top of. You know, life can be messy and stressful, and it's not just as easy as saying just meditate and relax.
And we know that's one's getting more and more challenging in the last few years, for sure.
Of course it is.
It?
People are juggling so much, but I mean, the reality of it is there is so much we can do ourselves to help our stress management. You know, just deep breathing, again, sounds a bit samey, but it is incredibly effective. The more you practice it, the better it is for you. Trying to focus on not just ignoring the fact that you're stressed and normalizing it, doing something about it. And actually, lots of these things are bidirectional. So if you exercise more, you are less stressed. If you sleep more, you're less stressed. And then you sleep more if you're less, and then they all work together. So you can't do
shimmy
everything
a day.
At once.
Is that not the new trend?
I haven't heard of that.
No, well, it's shimmy. You'll need to look it up. A shimmy a day keeps the sadness away. There you go.
Dancing, I guess.
Yes.
I suppose. Yeah. Brilliant. Exactly. Yeah.
But you said a lot of this is samey. I think a lot of us instinctively know all this.
Exactly.
Why aren't we doing it?
I know, and it is. It is the question. It is the question, and I have.
It's not as easy as get a smartwatch or do a shimmy a day. So what do you think from either from yourself, because as well, us medics, we know a lot of this, but we're not necessarily the healthiest people on the planet because we don't always follow everything. But either from yourself or let's say someone that you've helped with this lifestyle advice, if you could say one thing, I know it's not probably going to be one thing, but if there was one thing that really helped them go from knowing the advice to living the advice, what would that be?
It's a brilliant question. What I've realized as a doctor is the most common reason that I see that patients go from hearing my advice to living it is they have a health scare or a loved one has a health scare. And if I have researched it, tried to look up, you know, why do people not follow the advice that we all know? Yeah. And it's really complicated, and there's lots of behavioural economics and psychological stuff behind it. Exactly. But actually, what happens to a lot of people, so the main triggers for people starting a new lifestyle change and actually sticking to it is unfortunately a health scare for them or for a loved one. And I think for me, it's about trying to motivate people and help them, you know, make those changes and stick to those changes before the health scare comes, because when it does, it's really scary, and you will do anything you can to have reversed or prevented it from happening if possible, because 80% of the diseases that we die from in the UK, actually globally, are lifestyle induced. And it's you don't want to get to the point where it's a health scare that's triggering you. So it's really difficult, because it's hard to know what motivates people outside of that, because most of my experience is dealing with
You're
people.
obviously meeting them once they are ill. But do you find now that you have longer appointments, you're able to, in that time, I presume, treat people a little bit more holistically? You're able to introduce a lot more of that lifestyle medicine.
100%.
Are you seeing that impact in your patients and in your practice as a result?
That was the biggest difference that I noticed between private and NHS. I couldn't believe it. I remember when I worked in the NHS, and I remember most of my clinics were type 2 diabetics, heart disease, COPD exacerbations and smoking problems, and lots of things related to obesity. And that was your norm. And then when I moved into private and GP, I couldn't believe, firstly, how little of that I saw. Yeah. And secondly, when I, for instance, had a type 2 diabetic patient, a pre-diabetic patient, I remember when I was in the NHS, you're supposed to then counsel them on diet and counsel them on exercise, and look, why don't we try this for 3 months and come back and we'll recheck your blood sugar levels. And I never successfully.
And you also might never see that person back.
Firstly, you might never see them back.
Yeah.
But also, I remember, because you're cramming so much into such a short appointment, you're just firing information at this poor person who's just saying, just give me the prescription. Yeah. You know, and that's what happened. Then I found, when I had this time with patients, and I could really kind of share with them why it was so important that they changed their diet and did a little bit of exercise, and I couldn't believe it. Patients were coming back to me 3 to 6 months later, and we were reversing the pre-diabetes or the type 2 diabetes, and it was just. It was exhilarating.
It's what you went into medicine as well, isn't it?
To make that change.
But that is the other thing is it's a different mindset, because you have the time to explain. Because I have faced the same thing where you knew this. I mean, even the patients know it. Everyone's got a level of knowledge of lifestyle medicine. We know it, but they don't necessarily take action on it. But the reality is, because of shortness of time and because they're stressed in the NHS, and a lot of patients would just be like, just give me the tablets, give me the medicine. It's more your responsibility. It's, well, you make me better, rather than when you have the time to have a full conversation, to delve into what that might look like in their life as well, and therefore bring down some barriers, make it actionable. It becomes let us make it better, and that needs time. And so that must be one of the most rewarding parts of that transition.
And also it takes a lot of trust. That patient needs to trust that you're giving them the right advice and listen and want to listen to you. I'm not saying patients, of course they do. They do listen to us, but I think to take that information from a doctor, I feel like I would want to trust them. Do they?
But trust takes time as well.
And it takes time, and that's again what I loved about being a private GP was I know this patient. I've gotten to know them. I see them a few times a year, at least once a year for the medical, because we always did a medical, and there was that rapport, there was that trust.
Yeah.
And it makes an enormous difference.
Right, we're going to pivot a little bit because I want to ask her some quick fire questions, just nice quick answers, all right? We're going to try. First one is, what's something you find yourself saying pretty much every day to your patients? So some piece of advice that no matter what they're coming in with, you find yourself repeating this piece of advice all the time.
It would be probably when it comes to making health changes, and you don't have to be perfect, just consistent.
Love it. Love it. And do you find that you come across frequently like a mistake or a misconception patients are constantly doing where they think they're trying to improve their health, but it's really not?
Yeah, I think one for me, I mean, it's a really big topic, but exercise is for health. It's often seen as, I think if you approach exercise as this is going to be my weight loss tool, this is going to be my fat burning tool, you will be disappointed with exercise. It's so important, exercise. We should be exercising like we brush our teeth every day. We should exercise every day, but it is for health. It can of course help with weight loss or fat loss, but it's not the most efficient way. And if you view it like that, it's easy to become disenchanted with exercise and be frustrated by it. So exercise is for health, and nutrition is how you control muscle. Fat. Sorry, excuse me. Weight, fat.
Yeah, I like that. Yeah, abs are built in the kitchen, isn't that what people say?
Exactly. Yeah,
I love that. And how about for yourself, as a busy professional? How do you balance your health and your well-being?
I just try to nail the basics. I really prioritize sleep. I have a pretty strict bedtime and wake up time, which you've got to prioritize it and carve that out, and I do. I try to get exercise every day, whether it's a dedicated gym session or if I know I can't fit that in, I'm brisk walking everywhere, or I'm doing 15 minutes of weights or whatever. And I try to eat right. I really try to eat healthily because I feel so much better when I do. Even, I'm not perfect, obviously, far from it. I love a beer. I love chocolate. I love my husband's mac and cheese. But you are what you do 80% of the time. That's kind of a mantra that I hold on to. So that's sort of how I try to juggle it.
Sounds like you basically take your own advice then, and you also book in time for your health and wellness. You make appointments with yourself just like you would for, anything else, like going to a date with a friend or going to a work of commitment. It's just as important, and you have it carved out in your diary to
Honestly,
make it a priority.
I do, and I when I get to the end of the day, I will always think, right, how much exercise did I get in? Did I get a good sleep? Am I ready to go to bed now? What have I eaten today? Just to make sure I'm kind of I'm checking in with those parameters. It keeps me on track, and obviously I'm flexible, but I try to hold myself accountable to myself. And surprising actually how quickly these things become habits, and you actually miss them when they're gone, or you really notice a difference when you don't do them. So then it gathers momentum. It becomes easy to do. It becomes second nature.
You realise how good you're meant to feel.
Exactly. Yeah.
I love that.
Yeah.
I mean, I say that, but I'll be honest, I know all these things that you've shared, but I don't always stay that consistent with it. Yeah. And you've inspired me to go back. So I love that. Thank you. There you go.
I'm very happy to hear that.
But a lot of people, as I said, I've heard all this advice, they know it, and they try their hardest and they actually want to make the changes, but struggle with that. what are your thoughts kind of looped into all that? You know, we can do the sleep, we can do the exercise, we can do the eating well, we can do the stress management. But what about the extra tools that some people have through, let's say, the NHS? And I'm going to talk mostly about weight loss medications, for example. What are your thoughts on people including tools alongside those other things we talked about?
I mean, incredibly useful, you know, absolutely. There are some people who are fortunate enough to be able to do some of it or a lot of it on their own, but there absolutely are very legitimate reasons for people to make use of the tools that medics, pharmacists can provide to them. And I think, obviously, it depends which one there are, but I am full support of, for instance, the weight loss medications that are available to patients.
Have you had some patients that you've encouraged them to use them and had some good outcomes from that?
Absolutely. Yeah. And I think, look, when obviously GPs, doctors have been using these medicines for a long time, and it was mostly for diabetic patients. So we're quite comfortable using them. And I think, like a lot of GPs, when it came into the public domain, you know, to be used for exclusively for weight loss, you know, all a bit skeptical, you know, or I certainly was, you know, I kind of want to know more about this. Are we going to be doing more harm than good? What does this really mean? What are the ramifications for patients of this? And the more I have used these drugs, understood these drugs, learned about these drugs, I think they are a brilliant tool for patients who are struggling to lose weight, because I think the reality of it is, and I think there's a growing understanding or acknowledgement that obesity is so much more than just, it's multifactorial, it's really complex. There are genetics or epigenetics strongly involved in the process. And for some people, it is just simply not as easy as not eating. Or you know, swerving this and avoiding that.
Well, we've never said to not eat either.
No,
we said healthy
sorry,
eating, but I know what you mean. I know, but
like, I'm paraphrasing, but you're right. It's just not as easy. It's just not as easy. And there's real biochemical, physiological stuff going on with these people that, I mean, makes it challenging.
Yes,
challenging for them. And we have tools to help them. They have been studied. They appear to be quite safe, and I think they should be used. There is a very, very good role for them.
Yeah. And I think it's so important, I think, to hear that from someone who, sometimes we hear those who are passionate about lifestyle medicine would always be advocates for only just eat healthy and that's it. You should just have willpower and so forth. But I think using tools are a lifeline for some patients, as long as they use it as a tool and not the only method, and go in with that right mindset and go in with the other factors and go in with the creating the habits that they want to come out of it if they choose to come off those things.
Absolutely.
So,
because I mean, if it was just that easy, as you said, everybody would do it, you know?
Yeah, I love that. Going to pivot once more. And I would say, more for the medics who are listening to this, because we've talked a little bit about your journey at the beginning, and then we've talked a lot about your experience in telemedicine, and then a huge chunk of this chat has been about advice for patients. But I want to go back to, because I think there's quite a few healthcare professionals who are listening to this and love hearing your story. For those thinking about getting into telemedicine as a career, what would your advice be to them?
I would encourage it. I really would. I know obviously people will be constrained by, for instance, if you work, depending on who you work for or what body you work in, there are constraints that are individual to each person. But I think as a doctor, I'm quite a cautious doctor. So I remember years ago when I first started doing it, carrying a bit of anxiety with it. But actually, when you're experienced in it, you see how much easier it makes life for patients. It just works so well. Yeah. I really think it works very well. It has its limitations. You need to be comfortable with those and well versed in those. Yeah. But beyond that, it's a brilliant way for people to access healthcare, and it helps both the doctor and the patient. And
I think the reality is where the future of medicine is going. Not for everything, but it's certainly providing a solution to a need that there is out there. And it's been big in London for some time, but it's expanding across the UK now. So more and more healthcare professionals are going to be exposed to telemedicine being a big part of of how we serve patients who desire it. So that's good to hear. Thank you so much for today. I've honestly really enjoyed this conversation. You've really inspired me to really refocus back on my lifestyle medicine foundations, my sleep, my nutrition, my exercise, and my stress management, especially the sleep. And it's really interesting that we finished the end of this conversation talking about weight loss medications and how they play a role potentially in the right patients, as well as everything else we spoke about. Because next week, we're actually going to be talking to a pharmacist who specializes in weight loss medications. So make sure you tune into that. Have you heard something on the podcast that made you think, I need to ask a doctor about that? Well, good news, you can. With onlinedoctor.co.uk, you can book a same-day virtual appointment with a fully qualified doctor and get expert medical advice from the comfort of your own home. No waiting list, no hassle, just quality healthcare tailored to you. Book now and take control of your health.